Research-based instructional strategies and interventions, evidence-based practices, and high-leverage practices for students with autism spectrum disorder. EBPs and HLPs are both essential to provide students with high-quality special education instruction, but they are used for different purposes. EBPs are instructional strategies that have been proven to be effective through high-quality research. They are designed to improve student outcomes such as communication, behavior, or academic skills. HLPs are broad teaching practices that effective educators use with all students. They include collaboration, explicit instruction, assessment, and creating positive learning environments. HLPs describe how teachers teach, while EBPs identify which interventions research has shown to be effective for students with disabilities. A strength of EBPs is that they are supported with scientific research and have demonstrated success for students with specific disabilities or autism. However, they require specialized training and must be implemented with fidelity. HLPs are flexible and can be used across grade levels for different disabilities, making them effective in inclusive classrooms. The limitations for HLPs is that they are less specific to individual student needs and need to be paired with EBPs. An HLP that is effective for students with high-incidence ASD is explicit instruction, which provides clear modeling, guided practices, and immediate feedback. An EBP that is effective for students with high-incidence ASD is visual supports, including visual schedules, graphic organizers, first then boards, and visual cues for directions. An EBP for students with low-incidence disabilities, including autism, is task analysis, which breaks complex skills into smaller, more manageable steps, and systematic prompts with prompt fading to help students acquire new skills and increase independence. An HLP for students with low-incidence disabilities is providing positive and constructive feedback. These students require immediate and specific feedback to reinforce correct responses. This helps them to understand what they did well and what needs improvement. Considering when and how EBPs and HLPs are used and when are EBPs preferred over HLPs. When addressing specific individualized needs, EBPs are preferred. When a teacher needs interventions that have been scientifically proven to be effective for students with autism, a teacher will refer to an EBP. Examples include visual supports, reinforcement, and task analysis that have demonstrated effectiveness in improving communication, behavior, and independence in students with ASD. HLPs are preferred when planning and delivering daily instruction because they provide a framework for effective teaching that benefits all students in an inclusive classroom. HLPs are effective when creating an inclusive learning environment because they emphasize collaboration with general education teachers, special educators, related service providers, and families. Unlike EBPs, which target specific interventions, HLPs provide the foundation for effective teaching and can be applied across grade levels.